Hello, everyone. My name is Jenna Groman, and I'm the Director of Global Communities of Practice here at Sabin Vaccine Institute, and it is my pleasure to welcome you to today's event, Connecting Through Emotional Appeals. As we give people a moment to join, please share your name, your organization, and where you're joining from in the chat to let us get to know you a little bit. During today's session, we also encourage you to share questions for panelists using the Q&A function. And please continue to take advantage of the chat feature throughout the event to ask follow-up questions and engage with others on the call today. The Sabin Vaccine Institute and Bay Area Global Health Alliance are partnering to support the Alliance for Advancing Health Online, an initiative to advance public understanding of how social media can be leveraged to improve the health of communities around the world. Insights Dialogue is advancing this mission by curating research insights on a dedicated microsite. We're sharing peer-reviewed evidence, resources, and tools for the community to use, hosting the Vax Up podcast series, as well as hosting live events such as this one in partnership with Boost, a global community for immunization professionals. And it is my pleasure now to introduce you to our moderator for today's event, Nook Nudlovo. Nook.
Thank you, Jenna. Welcome, everyone. My name is Mwabizi Tandlovu. You can all call me Ngo. I'll be your moderator for this event, and I'm quite looking forward to this conversation where we're talking about connecting through emotional appeal. We've got quite a wonderful panel that we've put together for you, and I'll ask them to introduce themselves briefly. We have Tina, Mila, and Dan. So let me start with Mila, Dan, and then Tina. Please introduce yourself for those that don't know you and your work.
Hello, colleagues. My name is Mila. I'm a Communication for Development Officer at UNICEF, and I work in Ukraine Country Office on Social and Behavior Change Interventions for Public Health. Thank you.
Hi, everybody. It's great to be here today. My name is Dan Urchik. I'm an epidemiologist and public health researcher based in the Department of International Health at the Johns Hopkins Bloomberg School of Public Health. My research focuses on maternal and child health, including the determinants of vaccine acceptance, and also evaluation of community-based interventions to improve newborn health. Looking forward to presenting and chatting with everyone here today.
Good afternoon, everyone. Glad to be in your midst today. My name is Tina Bonyima. I am a C4D consultant working with UNICEF, Kanu, Feed Office, and I'm also a social mobilization consultant working for vaccine uptake in my district. Glad to be in your midst today.
Thank you, Tina. And I see a lot of Boost members on the platform in the audience, and they'll probably recognize Tina from the community. So welcome to the Boost members.
Thank you.
We'll start, thanks, Tina. We'll start with presentations of the work that Mila, Dan, and Tina do. Dan, let me hand over the floor to you to take us through your presentation, and then we'll hear from Mila after that.
Great, thank you very much. So once again, thanks for having me here. I'd like to thank the organizers of this event, the Sabin Vaccine Institute, the Bay Area Global Health Alliance, and the Alliance for Advancing Health Online for hosting this event today. My colleagues and I have been working over the last few months on an effort to understand how different communication strategies affect vaccine acceptance. So I'd just like to recognize them as well. Dr. Rupali Lamay is here. She leads this project. And she's joined the call as well as some of our other colleagues, including Alex Mitchell, Gretchen Schulz, Rebecca Shore, and Molly Sauer. And the work I'll present on today has been funded through a grant from the Sabin Vaccine Institute. Next slide. So last year, several members of our team conducted a systematic review to understand how vaccine information online affects vaccine acceptance. So specifically, they looked at interventional studies, observational studies, policy evaluations implemented on both social networking sites such as Facebook and content communities such as YouTube. So the goal was really to assess how communication interventions impacted vaccine knowledge, attitudes, and behaviors. Next slide. And what our team found, as you might expect, is that this field is quite new and that few studies have asked this question directly, and those that have done so in a very different way in terms of study design, location, intervention, and there have been many, there's a lot of variation in quality amongst other factors. However, the team was able to draw a few broad conclusions. They found that interventions grounded in behavior change theory, such as risk perception or self-efficacy theories, were more likely to address the underlying vaccine concerns. They also found that salient, actionable messaging and tailored approaches were critical for affecting vaccine behavior. They found that personal narratives, peer approaches such as peer education, were able to affect outcomes through the action of community norms. Vaccine discussions, especially those facilitated by a knowledgeable facilitator, and access to trusted experts can also positively impact these outcomes. And very few studies have examined the impact of these social media interventions in low and middle income countries. Next slide. So coming out of this systematic review, we wanted to look more closely at how different aspects of health communications impact vaccine attitudes and uptake. So this year we started on an effort to do that through two approaches. The first is to conduct a scoping review of peer-reviewed literature to summarize how variations in aspects of health communications can affect vaccine attitudes and uptake. And the second is to develop messages about COVID-19 vaccination based upon this evidence and conduct an online survey to assess their clarity and appeal for audiences from several different countries. Next slide. So the primary goal of our scoping review was to kind of quickly describe the existing literature to inform message development and testing through this survey. And in this review, we kind of cast a wide net, including interventional, observational, qualitative studies that at least presented original data on the effectiveness of a specific messaging approach on vaccine attitudes or uptake. And this included both in-person and online settings in a wide range of geographies. Next slide. So we defined three primary attributes of vaccination communications, these being the appeal, the approach, and the messenger. So the appeal is essentially the core message to attract recipients' interest and attention and impart the core information. The approach is the delivery mechanism by which to convey a specific message, and the messenger, of course, is the person or media that does the conveying of the message. So examples of appeal are disease focus or gain-loss frame. Examples of an approach are storytelling, tailoring, misinformation correction, and messengers could be health professionals, community leaders, teachers, etc. Next slide. So in the review, we included 43 studies after screening and applying the inclusion-exclusion criteria. And what we found was that studies varied very widely in terms of design, population, and physical location, online, clinic, school. Many different types of interventions were tested, including various combinations of this appeal approach messenger strategy. Studies were largely done in high-income settings, focused on a limited number of vaccines, especially HPV, influenza, and MMR. And although not formally measured by our review, there was high variation in study quality. Few studies assessed vaccine uptake or vaccination rates, and the effectiveness of these interventions varied substantially by context. Next slide. So I'll try and summarize. These are some of our key results. I'll try and summarize them very quickly. But essentially, despite the heterogeneity in the results, we were able to draw some insights from the data that we're using to develop our messages and then go ahead and test them. So for the appeals, we found that most of these were health outcome focused, taking an informative approach. But there were also some studies that used gain-loss frame or adverse events focus. The health outcomes appeals were effective for some populations, such as college students, but not necessarily for others. This varied a lot by context and setting. We found that gain-loss frame may be more useful among individuals with risky behaviors. In terms of the approaches, there's a lot of evidence that shows mixed results for misinformation correction. In some settings, it seems that it can actually reduce intention to vaccinate to backfire, but in other settings, this approach may actually improve attitudes. Storytelling on social media was quite interesting. It seemed to generate high engagement, but there are a few studies that have really rigorously evaluated the impact of this approach online. And of course, there's also a body of evidence that shows that tailoring messages can produce positive results in different types of populations in terms of attitudes and intentions and uptake. So finally, there's also well-established findings that healthcare providers are trusted messengers that can improve in some settings intentions and uptake. We found that high quality presumptive communication and persistent strategies were important for this type of communication. And for other messengers such as teachers and experts, there was kind of a lot of mixed evidence. Next slide. So in summary, the variations in design, intervention quality prevented kind of very strong conclusions that we could draw broadly across settings, although some of these individual studies did provide some interesting insights. But really, new studies are needed to rigorously evaluate the impact of combinations of appeal approach messenger strategies on uptake. Specifically, we need appropriately designed and implemented randomized controlled trials. We need to focus on measuring actual vaccine uptake rates instead of only knowledge and intentions. And we need to consider both in-person and online interventions and settings and try to understand their interlinkages. And lastly, we need to focus on other vaccines beyond HPV and influenza, and of course, much more research in LMIC settings. Next slide. So we use these results to develop simple visual messages in an online setting to encourage COVID-19 vaccination. So we developed 6 messages for 3 key types of vaccine appeals: disease effects, social norms, economic benefits. And then we just paired one of these different appeals with a different type of messenger, either a healthcare provider or peer friend. Next slide. So this study is ongoing, so I'm just going to give you this brief overview of the methods and then share 1 or 2 examples. So this is an online survey that we're now administering through Amazon's MTurk crowdsourcing platform. We're doing this in a number of different countries. And the way it works is that each respondent will view and evaluate all 6 unique messages, and then answer a number of questions about the ad and about their vaccine attitudes. We'll also collect socio-demographic data, and then the aim is to summarize their vaccine attitudes related to COVID-19 vaccination, and then understand the outcomes of interest for each ad and explore the relationship with participant characteristics. Next slide. So lastly, for my presentation, I just have 3 images that show you an example of these messages. So this is a disease message by a health professional. It explains, the seriousness of COVID-19 disease, the availability of a safe and effective vaccine, and a kind of nudge to take the vaccination. Next slide. So this is a similar type of message. This is a different framing, economic frame, and a different messenger, the peer. Next slide. And lastly, this is a social norm message. I've gotten the COVID-19 vaccine, so have many of my friends and family. Actually, most people have gotten it. And so this is a social norm type message with a peer messenger. Next slide. So thanks very much to the team at Johns Hopkins and also the Sabin Vaccine Institute for their support. I think at this point, I can now hand it over to Mila for her presentation. Thanks very much.
Thank you, Dan. That was really interesting to hear. I've heard a bit of about your study before, but I think the details were super helpful. I hope for the participants as well. But for me, since I work with these things practically on the ground, I think the research like this is something that we never have time, capacity, and framework to do. And it's amazing to see that somebody is actually doing it for us and helping us with things we can use in day-to-day work. So my presentation will be about a very specific case as well. This is something we did this year together with multiple partners who I will talk about a bit later. But what I like about this case and what I think is the true value of this project was that we managed to combine a lot of objectives at once. So on one hand, we had a very strong research component, and I will talk about it more. So we managed to test behavioral messages in several waves and understand what works and what doesn't work for our target audience here in Ukraine. We also managed to have an immediate impact. So beyond being a research study, it was an actual practical campaign for us, which helped us to boost COVID-19 vaccine uptake in Ukraine. And then finally, the third and an important result was that we actually now have the data we need for the campaigns that we're planning for demand generation next year. So now let's go into more details. If we can go to the next slide, please. So now we'll talk a bit about the context, just for you to know what we're dealing with. I will ask our colleagues to help me click through the several points that will be popping up on the screen now, if we can start and just click them through. So what we have in Ukraine is one of the highest level of hesitancy in Europe, vaccine hesitancy. We also have some of the lowest vaccination rates in Europe. So we're dealing with a really challenging context that had problems with vaccine hesitancy way before the national vaccination campaign for COVID started. If we can click again, what we have as well is low trust to the healthcare system and official messengers. And this is what we're struggling with a lot. People simply do not trust. Overall, dominant majority wouldn't trust Ministry of Health and the healthcare system in general, and sometimes the government. If we can go to the next one, is the complex misinformation landscape. Ukraine, as you may know, is not just the recipient of misinformation as many other countries, but we are also, unfortunately, one of the countries who are exporting misinformation. So we have here in Ukraine illegal misinformation hubs that are producing misinformation about vaccines, including for the external market. And the final point you need to know about Ukraine, and if you can click again, is that we have already have a multi-stakeholder demand generation effort. So whatever we do, we try to put in the context, and even international research studies such as this one, we're trying to put in the context of what is being done already to make sure that it's complementary and it actually helps the overall demand generation. If we can move to the next slide, I will briefly tell you about the scope of the project. So what's most important to mention is, of course, the partners who made it all possible. So we have UNICEF on one hand, which I represent, and we as UNICEF were in this story as the country office. And then there was also PGP, Public Good Project, so who I hope many of you know. They were there as one of the main partners. Then, of course, official Facebook was with us, helping us, and I will tell more about their role later. And finally, the main driver and the main idea generator behind the whole project was Yale Institute for Global Health, and they also pulled most of the research and analytical work and methodology design. What we did, which is the most important part probably, is that first of all, we had a very rigorous context analysis. It was a 3-month-long endeavor, and also with the help of Facebook and with the help of our local resources, we analyzed all the behavioral patterns and barriers colleagues from Yale needed to know to then develop the messaging. We then, based on that, developed 4 different digital campaigns that were linked in topic. It was COVID-19 vaccination. They were linked in design, but they were based on different behavioral approaches. And then we ran brand lift study, with each campaign reaching around 7 million people. Now we're at a stage when we subsequently run a quantitative survey, also via Facebook, to learn more about the outcomes of our campaigns. And based on the survey and the previous results, we're adapting the same campaigns over again. And we will be running them again, but already the improved versions that take into account all the insights we learned before. Let's move to the next slide, and I'll tell you more about brand lift study, which is basically at the core of the methodological story behind it. I'm sure many of you are familiar with what it is. And if you have ever done a brand lift study, it would be great if you can share the name of your country and the topic in the chat, because I'm really curious to know how widely this tool is used around the world. So brand lift study is a Facebook provided, a tool provided by Facebook and some other platforms. And what it allows to do is to basically run different messages and different ads in test group versus control group. If you can click several times for me, please, we will see the stages of the study. So yes, the 4th one, thank you. So first we start with randomizing the groups, and Facebook does it for you automatically. So they help you set it up, and you have a test group which is receiving ads and a controlled group which is not receiving ads. And then the test groups can be also multiple. So in our case, we had 4 different test groups. So each test group was receiving an individual set of messages. And then we had fifth group who were not receiving anything. After they received the messages or the campaigns in their Facebook or Instagram feed, we wait for a couple of days, and then all of them, so all 5 groups, receive questions that are embedded in their feed. So it's not a link, it's not an additional platform, it's actually embedded in Facebook, which makes this tool so unique. And then the questions, they're usually up to 5 questions that you can ask your users. And those are the questions that you then use to measure the outcome of the ads that you used. And then, of course, you then compare the questions, the answers to the questions from the people who saw the ads versus those who didn't see anything, and you can analyze which campaign had what effect. On the next slide, if we can please move to see the first campaign that we developed, and it was very simple in its design, and the main idea of the campaign was to deliver practical information. Even though we've been already half a year into the vaccination campaign, we still could see that there are people who are not aware that the vaccination is happening. So we just had a simple message. If you're a healthcare worker, time to get vaccinated against COVID, please do it. Here's the website. And interestingly, this is the campaign that was most memorable. So when we then asked people in their Facebook feed whether they remember seeing an ad about vaccination from UNICEF anytime in the past, most of the people who saw these ads said yes. So sometimes the most obvious and simple thing is the one that people remember. And also this approach gave the highest result in terms of switching people's intention to recommend vaccination to friends and relatives. The next campaign, if we move to the next slide, was about safety and efficacy, also a behavioral approach I'm sure you all are using. And here we just gave people specific facts about why they should believe that vaccines are safe and effective. For example, we mentioned that already 2 million Ukrainians received the vaccination. It is safe. Here we also a bit played with the social norm. We also mentioned, for example, that they're all pre-qualified by WHO, that international experts are testing them. And this safety and efficacy campaign was most effective in shifting perceptions of older people. So those not youth, but rather somebody over 35. And they were also more likely to then believe that UNICEF is a trustworthy messenger. So our main insight from this was that when you give people practical, rational information about safety and efficacy, they don't just trust the topic more, but they also trust you more as a messenger. And also this campaign delivered us the highest lift in agreeing that vaccination is important in preventing the spread of COVID. If we go to the next slide, the third campaign was about liberty. So it was liberty-based messaging. It was about choice. We basically framed vaccination as a choice, but not just to choose to get vaccinated, but positioning it as something broader. Choose knowledge, choose family, choose health. And this campaign resonated most with the males from 18 to 24 and from 45 to 54. So what's also great about brand lists and what makes the study more in depth is that you can have, sometimes you see you always have the disaggregation by gender and by age. And sometimes you can find the correlations that you can then work with in the future campaigns. This campaign was also highly effective in shifting risk-benefit perception. The final campaign that we ran was the fourth one. If we can click to the next slide, and it's about social responsibility. So we try to motivate younger people to get their parents and grandparents on board to get vaccinated and to activate them as messengers and as community leaders who would then motivate older adults. And naturally, this particular campaign had the highest impact in terms of persuading people to recommend vaccination to their friends and family. What's also interesting, this is the behavioral approach that was most successful in shifting and in strengthening the perception of social norms. So how we measured that, one of the questions we were asking after the ads was whether you believe your close friends and families, would approve of you getting vaccinated. And out of 4 campaigns, this particular campaign about social responsibility delivered the highest impact on actually people agreeing that, yes, my close circle is supportive of vaccination. So these are 4 campaigns. As you can see, the visuals are quite simple. It's not a creative campaign. It doesn't have anything complicated in terms of design or production, but it was very thought through in terms of behavioral messaging, thanks to our colleagues from Yale. If we go to the next slide, I will briefly mention the results. So measuring, we went through this already. Measuring was done on different levels, and how we can actually say that one campaign was more successful than the other. In addition to the questions we were asking afterwards, right? So the list I was mentioning several times, we would of course then also look at the objective metrics that you always have on Facebook. For example, the reach, the impressions, the click-through rate, and we took those into account as well. So on the next slide, we have briefly the results. So we had 100 million impressions. So 13 million users reached per campaign. It's for Ukraine with the total number of 35 million people. It's a great result. And the next result was, of course, if we can click again, was the positive shift in attitudes I just mentioned. And it was not just with the reach like this, it's not only hypothetical and it's not only for the research purposes, but it's actually real people receiving those ads and real people saying that, yes, now we're more likely to recommend vaccination to our friends and family, for example. And finally, the final result is the click-through rate, which was extremely high. We had 320,000 people clicking on the official government's website where you can find your nearest vaccination point. This is actually the highest traffic that a website has ever seen. And again, in Ukraine, it's relatively not a big country, so that's an amazing result in terms of the click-through. I think this is the main part. So if we move to the next slide, we can see the names of the partners again. And very briefly, Yale was responsible for design and methodology and also informing the messages together with PGP, who created the creatives. Facebook, of course, provided the platform and helped us with the technical advice and resources to roll it out. And we, as UNICEF here on the ground, were responsible for contextualizing the messages and also making sure that whatever we're doing as part of this international research project also makes sense for Ukraine as a country in terms of demand generation for COVID-19 vaccination. I think this is about it. Thank you very much. And I hope it was interesting and looking forward to your questions.
Thank you, Mila and Dan. And about the interest, you'll see in the chat box just how many questions our audience have been asking. So very, very large kind of interest in finding out more. And we'll get to that Q&A section in a bit, which will be moderated by my colleague Tina from the Boost network. But before we get there, I just want to invite the panelists to have a discussion based on the presentations that were just given. And I noticed, Dan and Mila, both your presentations emphasize the importance of understanding local context and social norms when creating these campaigns, the social media campaigns. Dan, let me start with you. What online data can help inform this work, and how can lessons learned from local on-the-ground activities be incorporated into social media campaigns? Dan?
Yeah, thanks very much. I think that's a great question. And, broadly from the evidence, we see that, tailoring messages is an approach that can be effective. So, I think really it's a balancing act between reaching a wide audience with a broader message and then tailoring your message to a specific audience and reaching, a more narrow group. And the kind of other piece of it is that this type of tailoring requires a lot of data. So understanding attitudes, knowledge, misinformation in a specific context. And so without that information, it's very difficult to do that type of tailoring. And so, we really need to kind of focus on approaches, online that look at social listening, kind of understanding, what people are talking about, having real-time data on concerns, rumors, etc., so that we can use those to tailor messages and then also to test messages. And the great benefit of working online, as we saw from Mila's presentation, is that you can test a wide range of different types of message appeals, approaches, etc., in a huge population very quickly. And I think that is really essential because, at kind of this day and age, we have a context that's shifting very rapidly. And people are communicating on lots of different channels. So to have that ability and that infrastructure to be able to do these kinds of evaluations and then feed that into programming, I think is really important.
Thanks, Dan. Mila, as the same kind of question to you. You said you ran this research for about 3 months. What data did you gather in that time to inform messaging?
So on the data collection stage, it's important actually to clarify that the campaigns themselves, right? So the 4 campaigns that I told you about, they were ran online for about 3 weeks, but the preparation stage, the data collection was around 3 months. So the data sources we used to inform then the messaging was, first of all, the national representative quantitative surveys that we do here in Ukraine. So it's face-to-face surveys that we use to measure knowledge, attitude, and practices. So that was the main one. We also then used our social listening data. So we were doing social listening ourselves, but Facebook also helped us to improve the effectiveness of this activity. And so we used that as well. And then plus we ran additionally in-depth interviews in April. So in-depth interviews and qualitative data was the third information source, and those 3 combined was then the basis for the further work. In terms of the localization, I think Dan covered it very well, so I probably wouldn't go into much details. The only message I have and what I feel is very important in terms of the localization is that when you're developing messages, for example, somewhere internationally, and you have an international group working on a project, it's very important to contextualize whatever the project is, not only by making sure that local social norms, language, and context is taken into account, but also by making sure that the current communications and media landscape is taken into account. Because sometimes what is happening, for example, in Ukraine, there would be a huge multifaceted demand generation campaign happening, and every second billboard in the country would be with the message on vaccines. And then if you run a study like this simultaneously with this campaign happening, of course, then the result is something would be not as ideal as you would want them to be, because the messages will not be in more or less isolated environment. And this is what we did for our testing. We made sure that those 3 weeks that we picked, that they're not overlapping with any other major demand generation activities happening in the country. And both for in practical sense and for research purposes, this is something what's really important.
Mm-hmm. And to that point about on-ground context on the field, I'm glad we have Tina here to talk to us about that, since she's an expert in that space and is located within the communities in Nigeria. Tina, can you talk about the local context? How can local context be understood through on-ground conversations? Do you have some experiences there to share? Tina, you're still on mute.
Sorry, good afternoon. I actually work in the local settings where I have to do everything manually. So I'm happy to be in this panel where I will be learning how to introduce some of the new social media technologies into my own activities at the grassroots level. So for me, to understand the local contests, I actually work very much with the community itself, in the sense that it is the community that has the issues, the challenges. So in understanding the local context, it is very, very important to look at the profile of that local settings. When you understand the profile of the local settings, you'll be able to identify the areas or settlements where you are going to focus in to address your challenges. For instance, in a local settings, we have different types of features. We have the slums, we have the hard to reach, we have the underserved, we have places that are not accessible. So if you don't know this, you will not be able to get an accurate data to be able to get your survey correctly. So when you understand the settlement profiles, you understand, then you work with the actors of that local context. Who are the actors? Who are you going to work with? Who are those that are going to support you in your project? So when you identify these people, then you also have to know who are your allies, those who are supposed to be those that are going to give you challenges. It's good that you also identify them. When you identify them, then you know who are your EPI teams, who are those people you are going to work with in the health sector, in the health facilities, or wherever you are partnering with as a researcher. Those people should be able to guide you on previous social data that you are going to look into and see if your direction is actually clear. And another thing that you should do is to also understand the roles of traditional leaders. Traditional leaders are very, very important in local settings. You cannot underestimate their power. They give consent. People respect them. They trust them. So you identify key influencers, key traditional rulers in that local context that have the same vision, that supports your program, that supports your objective for that particular contest. So when you are able to have this, then you are set, and your research definitely will come out with a good output. So these are some of the things that I do practically on when I am posted to any local setting. I work closely with the traditional leaders. I work closely with the influencers in the communities. I work with the youths. I identify the settlements, the hard risk settlements, the places that there are insecurity, where I cannot access. I have to know them. Then there are also other challenges that maybe previous non-compliances, outbreaks and all that. I have to put them together to know why was this really happening. Was it as a result of children not being assessed, or was it as a result of insecurities? And all this, when put together, we'll be able to know how we can really understand. Then you fully understand the local context where you are in. I think with this, I have been able to explain how to understand the local context. Thank you.
Thanks, Tina. I think that's a very important perspective. You mentioned religious leaders, chiefs with traditional authority in these communities. I want to pull Dan in here. Dan, how can we help those stakeholders that Tina has identified? Your religious leaders, your local chiefs, people that have, I think Tina called them influencers. We think of influencers as those people on social media, but in communities, you have these folks. So how can we help these leaders broaden their reach by using social media and digital tools? Dan?
Yeah, that's a great question. Thanks for that. I think that, one of the things over the years that the vaccination community has been able to do is to identify these types of local leaders and experts, and especially those that are very well trusted in communities. And obviously this is done at the local level, and it varies a lot by context. But I think for kind of traditional vaccination campaigns, we've been doing a better and better job of bringing in different types of people and sharing information through, trusted leaders and community members. So I think now really the interesting thing is, how do we translate that into the online space? And so, a lot of kind of traditionally trusted or respected voices in different communities, I'm thinking of scientists, pediatricians, for example, may not be very technologically savvy. They may not have a large following. And, I think a lot of research kind of needs to be done to figure out, whether that trust can be built in the same way that you can, make that connection in a clinic, for example, or at a community meeting. Can you do that same kind of thing online? Does that trust and communication operate in the same way online? And then also, thinking about different online spaces. So, we clump these together and say social media or online, but of course there's WhatsApp communication, there's Facebook, Twitter, YouTube, any number of things that we could be talking about when we're thinking about, helping local leaders, scientists, physicians, et cetera, to share information with their community. So I think, to me, this is a really interesting space, and I think, doing research to kind of understand how this type of communication operates, and then also building programs to help these experts, kind of absorb that information and get into the space and begin to communicate, try different things. And there are lots of different examples out there of physicians groups I've seen and who have taken to Facebook, for example, to share messages in their local communities in their in different languages, and of course, local leaders in certain settings that have built a really strong social media following and use that for any number of things to help their communities, including vaccination communication. So I think there's a lot being done out there, and it's kind of our job, I guess, as scientists and communicators, to figure out what are the strategies that really work, and then how can we evaluate them rigorously, get that information out there, and then begin to put these things into practice. And lastly, I might just say that this type of communication, I think, has really been underfunded and kind of underutilized, in public health sort of forever. I think now with the pandemic, a lot of, high-level people and leaders are kind of realizing the importance of communication, behavior change, et cetera. And I'm hopeful that, this research will really pick up, and that will understand that this isn't, there really is no silver bullet. These things are so complex and context specific that we need to invest in systems that can understand what people are thinking, what people's attitudes are, and then work to communicate regularly through well-funded systems to share information about health, broadly, including vaccination.
Thanks, Dan. I'm glad you brought up silver bullets and the like. And social media is definitely not, we're not saying it's the silver bullet here. So I see a lot of questions on the Q&A, and I'm just going to wrap up this section so that we get to them as quickly as possible. So as we wrap up, I want to ask all of you, and I'll start with Mila, then go to Tina, and then Dan. And Dan, you've already brought this up. It's about communication. It's really not about silver bullets. So how can we use both online and offline strategies to get the broadest reach, recognizing that social media is not always the right approach? So when is social media not the right approach? Actually, let me start there. Mila?
That's a very good question. When the social media is not the right approach, this year we're actually all about trying to balance out the social media and grassroots work with the communities. I will start with saying when it's the right approach. If you're a digitally connected society and you need to reach many people in a short period of time, this is where you go. You go on social media, and sometimes social media can get as a platform more creative and more integrative of the offline leaders than just running Facebook ads like we did. When Tina and Dan were speaking, I thought about the projects we did this year when we partnered with a network of religious leaders from different religious groups And there were around 50 people, all with large following bases of their own in their own local little communities. So there would be a group of villages, and every single person who's on Facebook in this village would follow this one priest from this one church, because for them, he's an opinion leader. So we partnered with them, and we were giving them every week a piece of information about COVID or COVID-19 vaccination. And they were as simple as copy pasting this information to their page and saying, hey, this is something you need to know. And it's somewhere on the edge between being social media and then using offline influencers who impact communities. And I think sometimes these tools are what's really important. However, sometimes it's also important to be honest with yourself when social media would not work. And this is what we're struggling with in Ukraine, for example, with older adults and COVID-19 vaccination, because we have an extremely low rate of vaccination among people over 60, and we want it to be higher. And now we know that no more Facebook, it's not going to work with them. So then, of course, you change your strategy for this particular group, and you go and you find them where you can find them, in a postal office, in a bank receiving pension, meeting their grandchildren, but of course not on social media.
Thanks, Mila. Dan, 30 seconds, and then we'll hand over to Tina.
Yeah, great. So, I mean, in 30 seconds, I think, the key really is social listening and, developing tailored messages, and then evaluation and research. I mean, may be obvious coming from me that I'm going to advocate for research, but I think in the vaccination space with vaccine communication, we often see counterintuitive results, and I think again and again that just reinforces that the messaging and the approaches that we think might work are going to vary by context and may not actually work in the way that we think they do. So I think it's really about investing in the systems to understand what's going on, and then trying different approaches, different combinations of these, appeals, approaches and messengers. And then, once we figure out kind of what's working, implementing that kind of on a wider scale. So I think in 30 seconds, that's what I would put out.
Wonderful. And Tina, you can close us off here and then pick up the Q&A. Your thoughts? You're on mute, Tina.
Okay. Sorry. Well, I'm going to start with the Q&A. I don't know. I just took a break. The internet went a little off for a while, so
we're talking about exactly those challenges, online, offline. It's live right here, so you can carry on.
Yeah. Okay. Okay. Yeah. Thank you. The issue here is that the community where I work with doesn't need they don't have the online experience of how
I think Tina might be having connectivity issues there. Tina, can you hear us? Maybe if you just switch off your camera for this bit, we can have a better connection. Jenna, can we help Tina? And then I'll just pick up the Q&A just for now. And when she rejoins us, she can take over. All right, so we have a bunch of questions. Dan, I'll start with you. Can you post the link to the social media strategy to affect vaccine acceptance study? And another one from Tuneshri says, how is survey respondents recruited? Dan?
Yeah, thanks. So I hope to be able to share the link soon. We're preparing the manuscript for publication. So, once that's done, that should be out there in the public space. In terms of the mechanism for recruiting participants. So this uses Amazon's MTurk platform. So we kind of select a number of different parameters, including country.
All right, thank you. We have
and then
very bad weather.
No problem.
Okay. All right, Tina's back. Tina, Dan is just finishing his thought, and then you can pick up after he's done. Dan, just finish your thought. Thanks.
Yeah, thanks. So, yeah, so
Okay.
it's it's a very kind of simple recruiting process that's based mostly by country, and the idea is just to get you know, a large number of people to, you know, by country to look at these messages to give us some input so that we can revise for the next phase of testing. Over to you, Tina.
Tina, are you still with us? All right. Let me try this. Mila Chinenyenwa says, how long did it take to conduct the study? And what was the belief behavior translation of the study? And then another one, how far do social media platforms engage in helping with social listening tools to target messaging? Mila?
Yeah, so with the first question, even though the actual campaigns took just 3 weeks, the work on a study like this, it's a long process. So if you are going for something like this, especially with 4 partners in 4 different countries, you need to be mentally ready that it's going to take time. So for us, from the moment we had our first call with Yale to up until now, when we are still 2 months far from the end, it's been like 10 months, I think. So I would say that to be on the safe side, it's a year. If you want proper situational analysis, you want several waves of retesting and reanalyzing, then you should plan that it's at least 12 months. But of course, if you go for 1 wave, you can then probably do it in half a year. In terms of social listening, I think it's a very interesting question that we're asking ourselves all the time as well, because we do social listening a lot, but we're always struggling with building this bridge between social listening and actually informing the behavioral messages based on social listening. Because when you have a result from a quantitative survey, it's quite easy to translate it into the strategy. But when you have picks rumors here and there, and then you have talks here and there, it really takes an effort. So in our case, Yale did a lot of heavy lifting in terms of going through and translating. We actually translated hundreds of messages, comments, and posts from people on Facebook, and then they merged it together. But that's quite a resource and time consuming.
Mm. Thanks, Mila. We have time, I think, for 2 more questions. Tina, do you want to take them? I think they're highlighted in yellow there in your screen, Tina. You're on mute, Tina.
I want to take this question for, this question is, as scholars, as school teachers are also key in motivate of demand to vaccine uptake. I think this is a question here from Mohammed Abubakar Gaba. So
Can we take that question again, Tina?
Dan take that? Can Dan take that?
Can you just repeat it one more time, Tina? The question?
Yeah. The question is that are school teachers also key in motivating demand to vaccine uptake? Are school teachers also key in motivating of demand to vaccine uptake? This question is coming from Mohammed Abubakar Garba. So please, I want Dan to share his thought on this question. Hello.
Yeah, I think so. You know, teachers are kind of independent, trusted source in a lot of places. You know, anecdotally, some work that I did in India during the measles, the rubella campaign there, teachers, the campaign was delivering in a school setting, so teachers were critical, and headmasters were critical to communication with parents about the campaign. So I think, you know, generally teachers can be important, and certainly in those types of settings, teachers are critical to vaccine communication.
Great, thanks. One more question, Tina, and then we'll have to wrap.
Okay, let's go to Ibab Bala. He said, one last question. Is it free on Facebook or paid? I think he has asked a question before. Let's go up. He said, good day, everyone. Ungo, nice seeing you on again. I'm great to discuss team. Given the wide range of social communication platform and the infodemic crisis most countries face now, how infodemic crisis most countries face, how do you see the issue being addressed to increase vaccine uptake? Or do you see the issue of infodemic being addressed globally anytime soon? The question is coming from Benedict Felix Regis. So please, I would like Mila to share her thoughts on this. I think it's on Facebook and social media too.
Thank you for the question. I think what's important to understand about misinformation, which is one of the things we dislike about infodemic, right, is that misinformation will not be addressed at all. Misinformation is not about eliminating it at all, because misinformation will always exist. Misinformation is something, unfortunately, natural that you have in all communities. What can be done is misinformation management. The same with infodemic. We can manage the infodemic. We can limit the negative impact it has on people's life. We can make sure that our audiences are more resilient to misinformation and disinformation they receive. So this is, in terms of the discourse, I think this is where we should be looking at. Whether it's done on the global level, I think that there's always more that can be done. I think we as individual countries, we're genuinely struggling a lot with this. So whatever new tools, and there is, for example, vaccine misinformation management guide that UNICEF recently produced that I recommend everybody checking out. So things like this that are coming from the global level definitely help. And we look forward to receiving more and more of them to help us inform our work on the ground.
Thanks, Mila. And thank you, Dan, and thank you, Tina. Unfortunately, we don't have time to go through all your questions. We'll try and get responses to them and put them on the Boost platform. Speaking of which, let me hand over to Jenna to close us off. Thank you, everyone.
Thank you so much to our panelists and to all of you for joining today. Just very quickly before we close, as I mentioned earlier, this is part of a broader initiative, and we really invite you to stay engaged with Insights Dialogue as we move forward. You can explore more at insightsdialogue.org, as well as join the Insights Dialogue Learning Group on Boost. And we will work with the panelists to continue answering some of the questions, because there have been really many very interesting questions posed during this session. Please also just take a moment to take our post-webinar survey to share feedback and help us shape future events. The link is in the chat window. And as we wrap up, I want to just share 2 upcoming events for your awareness. Our Bright Spots webinar next week on December 14th, we'll talk about how strategic partnerships were used by PATH in Vietnam to develop a national electronic registry for immunization. And Sabin's Vaccination Acceptance Research Network is hosting an inaugural conference in March. Registration is now open and the call for paper closes next week. So we invite you to submit your strategies used to support vaccine acceptance and uptake. And on that, I will close today's session. Thank you so very much again for joining, and we look forward to speaking again soon. Bye-bye.